Welcome back to Mountain Connections. The holidays can be very joyous for many, but also very difficult for many individuals. What can you do to help support those you love who may be struggling with their mental health during the holiday season? And how do you know if you need some help? And what should you do? We've got some great information right now. Let's take a look. The holiday season can be a joyous time of year marked by good food and celebrations with family and friends, but it can also be a hectic and stressful time for many people. In fact, research shows that the holidays can be particularly challenging for the nearly 1 in 5 Americans who are living with pre-existing mental health conditions. Here today to tell us more is family psychiatric nurse practitioner, Dr. Jessica Whelan. Thanks for joining us today, Dr. Whelan.
Yes, thank you so much for having me.
So how can the holiday season impact people who struggle with their mental health?
Yes, actually 64% of patients with mental health conditions report that the holidays actually worsen their mental health condition, which is why I think in my practice, I've always said that the holidays are psychiatry's busy season, and definitely why I am happy to be here as a compensated spokesperson on behalf of AbbVie, hopefully to talk about this subject and spread some light for those individuals that may be wondering, are they struggling with the holiday blues, or maybe is this something like bipolar 1 disorder?
So what is bipolar 1 disorder and what are the symptoms?
So bipolar 1 disorder is a chronic health condition. It is described by or categorized by having high and low mood swings. The low mood swings or periods of depressive episodes, those may lead to patients frequently being misdiagnosed with major depressive disorder because the symptoms do overlap. These periods last at least 2 weeks. Feelings may come along of fatigue, feeling sad, having low energy. This may look like a patient not wanting to get out of bed in the morning, may not wanting to go to work, having little interest in their typical hobbies or activities, having change in appetite. But what sets bipolar 1 disorder apart is that it is also accompanied by having manic episodes. And these episodes are periods of elevated energy. But the elevated energy may not be positive energy, which is frequently what people think about. It can also be negative energy, like increased irritability. This could be racing thoughts. It could be trouble finding much wanted sleep. It could be impulsive behavior, risky decision making. And during the holidays, this could actually be exhibited by spending money that we don't necessarily have.
Given the stress of this time of year, how can people know if unusual moods or behaviors or feelings are just the holiday blues, or if they may be signs of bipolar 1 disorder?
So this is where I always recommend opening communication. It's vital to start talking with healthcare practitioners early on. Don't have that fear. I think a lot of people are quick to write off potential symptoms when you might be struggling with something. And it's worth talking about. It could be nothing, but it's worth getting it checked out. That aside, the holidays are stressful, but if your symptoms are self-limited to the holidays, and as soon as the holidays end and go away, then that would just be the holiday blues, so to speak. But bipolar disorder, again, is going to happen throughout the year, and you're going to have symptoms that are chronic in nature.
And for those who have been specifically diagnosed with bipolar 1 disorder, can you share advice to help manage their condition, especially during this very unique and unprecedented holiday season?
Of course. So in my practice, I like to recommend quite a few different things. I usually start with talking about mindfulness. Tracking your mood is exceptionally important. You can get mood charts online, but in this day of technology, you can get an app right off your iPhone or Android. But I always tell patients you should include family members and friends in helping track your mood. It's important to have others involved as part of your care team and being aware of what's going on. It helps decrease stigma and increase awareness. It's also important to practice self-care. Get those 8 hours of sleep, being not working those 16-hour days, which I could probably be better at. But first and foremost, getting on that proper treatment is important. And one of the medications that I found to be very effective in my patients with bipolar 1 disorder has been Whelan or cariprazine, which is a FDA-approved medication for adults with depressive episodes or the short-term treatment of mixed or manic episodes in bipolar 1 disorder. Something to keep in mind, all medications do come with potential side effects. It would be important to report these to your healthcare practitioner. This is not an approved medication for dementia-related psychosis, and so the elderly are at higher risk for stroke and cardiovascular issues with medications. They would need to be made aware of that. Children and young adults with any depression-related medications are at higher risk for suicidal thinking and need to be closely monitored. Anytime you'd have nausea or changes in muscle movements, any kind of blood sugar changes or metabolic changes, those would also need to be reported. Obviously, if patients want to learn more about safety tools or risks, they can go to the website about this medication at www.vraylar.com.
No, thank you so much, Dr. Jessica Whelan, for joining us here on Park City Television. Such important information. I know that we have individuals in my immediate family that struggle with this, and I really appreciate the advice, especially during this tough holiday time.
Thank you so much.